Has the COVID pandemic caused you to fall behind on your rent? What about your electric or water bills? Well, VIHFA's Emergency Rental Assistance Program is here to help you catch up. For program details and qualifications, go to VIHFA and click on the ERAP link. From there, it's just 3 steps. 1. Make sure you are eligible. Have you lost income due to COVID-19, owe at least 1 month of rent or utilities, and meet the federal household income guidelines for your island? 2. Gather all the required ID and documentation for all members of your household, plus statements from your landlord or utility company. 3. Submit your application online at vihfa.gov or call one of the intake centers on your island to make an appointment to apply in person. For more details and locations of the intake centers, please visit vihfa.gov.
Good day. Welcome to the Government House Weekly Press Briefing and COVID-19 update for the week of February 7th, 2022. It's good to be back home from the frigid weather in Washington, D.C., although it appears that weather is trying to find its way here to America's paradise. For the benefit of the radio listening audience, I am Government House Communications Director Richard Mota. Governor Bryan returns to the territory later this afternoon. Joining me for this afternoon's briefing is Deputy Commissioner Ruben Malloy on behalf of Health Commissioner Justa Encarnacion for the latest COVID-19 data and information on where Virgin Islands residents can get a free COVID-19 test, vaccine, and booster shot this week. Commissioner Malloy.
Good day, and thank you, Director Mota and Commissioner Encarnacion, for the opportunity to provide COVID updates today. Before I begin with our numbers, on behalf of Commissioner Encarnacion and the rest of the Virgin Islands Department of Health team, I share a sincere thank you to those who have taken a step to protect themselves and the community by getting vaccinated and boosted. Also, thank you to those who continue to hold steadfast to Governor Bryan's and the department's guidance to ensure a reduction of COVID-19 transmission. We are a remarkable people, and we are grateful for all the cooperation that we received and from the other agencies, private supporters, and the community for seeing us through the Omicron surge. It's not over yet, but we are doing better, so thank you. As of February 7th, 2022, a total of 316,197 tests have been conducted in the territory. Of these tests, 15,024 individuals have tested positive. The 7-day positivity rate is 4.53%. There are currently 324 active cases in the territory, 211 active cases on St. Croix, 89 on St. Thomas, and 24 on St. John. 14,598 cases have been recovered, and we have suffered 103 fatalities. Prayers and support to those who have lost their loved ones. Fortunately, we are seeing a decrease in our positivity rate and our active cases. Our current positivity rate is 4.53%. We do, though, continue to experience a high rate of hospitalized individuals. This is one of the residual effects of the Omicron surge. The Governor Waneflui Hospital and Medical Center reported 11 COVID-19 admissions and one vented. The Schneider Regional Medical Center reported 6 COVID-19 admissions with 2 vented. Let's all do our part to keep our COVID-19 numbers and the hospital admissions down by getting vaccinated, wearing a mask, practicing social distancing, and washing our hands frequently. It is also critical that we stay at home when we feel sick. Now, here are some additional updates. On Wednesday, February 2nd, the Department of Health shifted back to the former schedule for testing events on St. Croix and St. Thomas. The hours are now from 9 a.m. to 12 p.m. by appointment. Please use the link www.covid19.usvi.care to pre-register for testing. The testing on St. John will not change. We will continue to have pop-up testing and vaccinations 3 days a week until further notice. With the improvement seen in the Omicron surge and the reduction in new and active cases, we are confident we can safely resume our regular daily testing hours. The epidemiology hotline numbers are accessible from 8 a.m. to 10 p.m. for callers to report suspected cases at 340-712-6299 or 340-776-1519. Registration for testing can be completed online, COVID-19usvi.com/testing. Pop-up vaccinations continue throughout the community at various sites. Here's the current schedule for pop-up vaccination sites throughout the territory. Tuesdays and Thursdays from 12 p.m. to 3 p.m. at Costules on St. Thomas, and Wednesdays from 1 to 4 p.m. at the Port Authority Gravel Lot on St. John. The St. John location also has free COVID-19 testing available from 12 to 3 p.m. Department of Health is also providing free COVID-19 vaccines on St. Croix at the market, formerly known as Plaza West, every Tuesday and Wednesday and Thursday from 10 a.m. to 1 p.m. and at the Farmers Market at the Agricultural Fairgrounds on Centerline Road every Saturday from 7 a.m. to 11 a.m. The current schedule for COVID-19 vaccine for ages 5 to 11 is Tuesdays and Fridays at Maternal Child Health on St. Thomas from 8 a.m. to 4 p.m. and Monday through Friday at Community Vaccination Center on St. Croix from 8 a.m. to 5 p.m. For ages 5 and up, you can schedule an appointment by calling 340-777-8227. For ages 5 and up, you can schedule yourself or your child online at covid19usvi.com/vaccines. If your child is homebound, the Department of Health can also bring the COVID vaccine to you. If you are a parent or guardian of a child aged 5 and up, please make sure to accompany the child to his or her vaccination visit and bring an ID for both the child and you as well as the child's birth certificate. Great news. The VI Youth $250 gift certificate giveaway began on January 31st and will run through Friday, March 18th. Any child residing in the USVI between the ages of 5 and 17 who receives second dose of Pfizer between those dates will receive a $250 gift card at the time of the second administration. No need to wait. Also, no need to worry. Children who have been fully vaccinated prior to January 31st will receive their $250 gift card if they were not already rewarded during the previous incentive initiative. These gift cards will be distributed beginning February 16th at the CVCs on St. Thomas and St. Croix and at the Morris de Castro on St. John during the hours of 9 a.m. to 4 p.m. To keep up with the latest information, including COVID-19 epidemiology and COVID-19 and vaccine data, please visit the USVI Department of Health Facebook page or website www.covid19usvi.com, and for COVID-19 health information alerts, text COVID-19 USVI to 888-777. On another note, the Virgin Islands has recently confirmed 2 cases of Legionnaire's disease. Legionnaire's disease can be a deadly illness if not diagnosed and treated quickly. However, the cases are usually isolated. Symptoms may include cough, shortness of breath, muscle ache, headache, and fever that may lead to pneumonia. It is caused by a bacteria usually associated with warm water. The most common places in the Virgin Islands where this bacteria can be found include cisterns, water heaters, hot tubs, or commercial air conditioning systems that are cooled by water. Regular and proper cleaning of these types of water receptacles is recommended to prevent the spread of the disease. It is not caused by ingestion of the water, but rather by inhaled water particles from the contaminated source. It is also not contagious from person to person like other respiratory diseases. Thank you, and I'm happy to take any questions. Back to you, Director Moda.
Thank you, DC Malloy. As you all know, our students are back to in-person learning. To protect the health of our students and school-based personnel, we continue to encourage parents to get their children vaccinated and continue to encourage our school-based personnel who are not yet vaccinated to please get the vaccine. In that vein, we have announced an incentive program like those done in the past to encourage the parents of our students aged 5 to 17 to have them vaccinated. As DC Malloy just announced, minors ages 5 to 17 will receive a $250 gift card once fully vaccinated in the territory. The VI Youth $250 gift card giveaway begins on February 14th and runs through Friday, March 18th. Any child residing in the U.S. Virgin Islands between the ages of 5 and 17 who receives the second dose of either the Pfizer or Moderna vaccines between today and March 18th will receive a $250 gift card at the time they receive their second dose. We also want to thank those parents who trusted the science and did not hesitate to get their children vaccinated as soon as the COVID-19 vaccines became available for their young ones. Those children who have already been fully vaccinated before today will also receive a $250 gift card. The Department of Health is compiling the names of those individuals and preparing to distribute the cards beginning on February 16th. The gift card is per child, not per household. So if you have more than one child in your home, each fully vaccinated child receives a gift card. Some children between the ages of 12 and 17 already received a $250 Visa gift card in our first gift card giveaway held last year. And so unfortunately, those minors will not be eligible for this second go around. As a reminder to the traveling public, effective February 2nd, 2022, the territory reverted back to its original travel protocol, which requires a 5-day testing requirement or proof of a USVI vaccine record for travelers entering the territory. So if you are traveling into the territory, all you need, if you're traveling into the territory after February 2nd, all you need is either a negative PCR or antigen test taken within 5 days of the date of your travel or proof of vaccination within the U.S. Virgin Islands. And so for more information on the territory's travel protocols, you can always visit usvitravelportal.com. Again, that website is usvitravelportal.com. And there you can keep up with the latest on all of the travel protocols to enter the territory. In non-COVID related news this afternoon, Governor Bryan is holding a bill signing ceremony at Government House in Charlotte Amalie, where the governor will be joined by members of the 34th Legislature's Subcommittee on GRS and key stakeholders for the signing of the bill authorizing the government to refinance our RUM cover over matching fund bonds at current market interest rates to free up critically needed revenues to bring solvency to the GRS. This is certainly a big deal for the territory and a major step forward in the effort to protect the pension plans and benefits for both our active and retired government employees. Tomorrow's bill signing ceremony will be broadcast right here on our Facebook page and also shown on the Government Access channel, which is channel 27 if you have VIA. As I leave this afternoon, I want to inform the public that the First Family has temporarily vacated the official residence at Government House in St. Croix as the residence is undergoing critical maintenance. The repairs, according to the contractor, are expected to take a month to complete. In the interim, the First Family will reside at the rental residence in St. Thomas and at a private residence in St. Croix. And so we just wanted to inform the public of that. I will take any questions from the media at this point. if there are any. And I see that we have a couple of media partners on the line. I will start with Suzanne Ellis from the Virgin Islands Source. Suzanne, go ahead.
Hi, good afternoon, Richard. A couple of questions for the Assistant Commissioner Malloy about Legionnaire's disease. Can he tell us where they suspect these 2 cases contracted the disease, and are they hospitalized?
Thank you, Susan, for the question. There was 1 case on St. Croix and 1 case on St. Thomas. We as public health professionals have to balance and protect the safety of the public versus the privacy of individuals. So we provide information that that we think will allow us to achieve that. So we're a small community, and we don't want to give out too much information that will allow individuals to be identified. But 2 cases, 1 at St. Croix, 1 at St. Thomas.
Can you give us any kind of generalized idea, like did they maybe contract this off island, out of the territory, or in a public place, or it sounds like a pretty serious disease, and if people had an idea of what to look for, where they might be aware of getting in trouble. So can you just give us some idea if it was a public place or private or off island?
I don't have that information available. However, as was stated earlier, it cannot be contracted person to person.
Right.
You can catch it by aerosolized water vapors, and it's prone to growth in warm, moist environments.
All right, thank you, Assistant Commissioner.
Thank you, Susan.
The Virgin Islands Daily News, I'm not sure which reporter is online, but we have someone from the Virgin Islands Daily News. Go ahead.
Good afternoon, this is Sarah Kirkpatrick with the VI Daily News, and I had a question for Deputy Commissioner Malloy. Of the admissions, the hospital admissions for COVID-19, are any of those admissions fully vaccinated persons?
From what I know, the one FW Hospital Medical Center posts every day their numbers, and they include how many persons are vaccinated versus not vaccinated. I do not know the total numbers right now, but what have been reported is usually if there are 11 persons, for example, 10 would be unvaccinated with 1 vaccinated.
Okay, I can check that. And then my other question, I think, with the Legionnaire's disease was the same as Susan's. As the 2 cases that we have, are either of those persons hospitalized?
I do not have that information.
Okay, thank you.
Thank you.
Thank you, Suzanne, and thank you, Sarah. I believe that is it for our questions this afternoon from the media. With that, I would just like to remind the public to continue to wear your mask, practice social distancing, and remember to get both the vaccine and the booster now that both are available. Thank you, and we will see you next Monday.